Modifiers. At times, a CPT code needs to be reported with the addition of a modifier. Modifiers give additional information when necessary about the CPT code to a third-party payer to ensure that claims are paid correctly. A CPT modifier is a two-digit code that is appended to the CPT code to indicate that a service or procedure has been altered for some reason, but it does not change the main definition of the code. The modifier further describes the service performed. There are two types of modifiers that are used with CPT codes. Level 1, which is CPT-4 modifiers, which are two-digit numeric codes, whereas Level 2, HCPCS and National modifiers, are two-digit alphanumeric modifiers. A complete listing of Level 1 and Level 2 modifiers is contained in the Healthcare Common Procedure Coding System, or HCPCS, and are commonly found in Appendix A of CPT books. Coders can become familiar with the modifier codes and descriptions by reading Appendix A of the CPT manual. Modifiers are used for various reasons, including when a service or procedure has both a technical and professional component, a service or procedure was performed by more than one physician, a service or procedure was performed in more than one location, a service or procedure has taken more time to complete than routinely would occur, a service procedure was reduced or increased, only part of a procedure was completed, a bilateral procedure was performed, a service or procedure was completed multiple times, an unusual event occurred during the procedure, an accompanying or adjunctive procedure was performed. When billing for physician services, modifiers should be placed in item 24D of the CMS 1500 form. This would follow the CPT code. Appendix A of this textbook that we are using provides an example of the CMS 1500 form. Reference Appendix A of this textbook to locate where to place the modifier on the CMS 1500 form. Not all modifiers are approved for the use on ambulatory surgery claims. The list of approved modifiers is reviewed annually. Appendix A of CPT indicates modifiers used in the ASC setting in separate section of the appendix. Remember, the CMS 1500 form is located in the back of your workbook. Block 24D is for the modifier use after the CPT code. There are two modifier fields. For Medicare claims, when you enter only one modifier, enter it in the first modifier field. When more than one modifier is submitted, the modifiers must be ranked according to whether the modifier will affect the fee for the service. Modifiers that affect pricing are listed in Table 2-1 in your work text and should be reported in the first modifier field because it directly affects the fee for the service. The modifiers listed in Table 2-1 are often referred to as pricing modifiers, and they either increase or decrease the fee for the service. The remaining modifiers, often referred to as statistical modifiers or informational modifiers, are used for informational purposes and have an impact on the processing or payment of the code billed, but do not affect the fee. Table 2-2 in your work text lists the statistical informational modifiers. Statistical modifiers do not affect the fee. And remember, they are sequenced after the pricing modifier on the claim. Modifier 99, multiple modifiers, indicates that multiple modifiers are needed for an individual CPT code. This modifier is not recognized by all insurance plans, so coders must review the coding guidelines for plans that are being billed. Medicare recognizes Modifier 99, and coders should refer to Medicare Administrative Contractor information for instructions on reporting this modifier. Many Medicare Administrative Contractors require Modifier 99 to be entered in the first modifier field when more than 2 modifiers apply. ASC, Ambulatory Surgical Centers. These modifiers are not all modifiers are approved for the use in ambulatory surgery claims. The list of approved modifiers is reviewed annually. Table 2-3 in your work text lists the currently approved modifiers. Appendix A of the CPT book also lists the modifiers that are approved for the ambulatory surgery setting. Please familiarize yourself with the modifiers used in this setting by reading the listing and the modifier's description in the appendix. The best way to understand how to use modifiers is to review the definition for each modifier found in Appendix A of the CPT book. In the workbook, however, you can review the use of each modifier and where it gives examples of cases that require the modifier use. The titles of the modifier are listed as they appear in the CPT book. Please review. HCPCS Level II modifiers accompany the HCPCS Level II CPT codes. HCPCS is an alphanumeric system that describes services provided by physicians and other providers. The HCPCS system also provides codes for ambulatory or ambulance services and durable medical equipment, DME. DME services include such things as crutches, walkers, and canes. These codes may or may not be reimbursed. The coder, as well as the providers, needs to know that because just as in CPT code for a service exists, that does not mean that the service is reimbursable. This is something that the insurance carriers should be contacted about. HCPCS modifiers are assigned for the same reason that other modifiers are assigned. The service being provided needs to be further explained. The following is an example of an alphanumeric modifier. Identifies the various body parts that might be needed to identify when multiple procedures are being reported. Here we see E1 for upper left eyelid, E2 lower left eyelid, E3 upper right eyelid, E4 lower right eyelid. Have F1 for the left hand second digit, F5 for right hand thumb, FA for left hand thumb. And then we have our G modifiers. G modifiers, it's important to know these if you're dealing with Medicare patients. If you use these modifiers, it will help to prevent denials. Here we list GA, GZ, and G modifiers, which are important to the outpatient setting. GA being a waiver of liability statement on file, such as an ABN, a GY, item for service statutory excluded or does not meet the definition of any Medicare benefit, and GZ, item or service expected to be denied as not reasonable and necessary. Here we have the TC modifier, or technical component. This one is used for identifying technical component of a procedure. It's appended to the code to show only the technical component has been completed. And it should not be appended to codes that represent the technical component. Other commonly used modifiers are LT for the left side, RT for the right side, T1 through T9, and TA identifies foot and digit. So in summary, modifiers offer additional information about a code. The modifier can impact the payment, and both CPT and HCPCS modifiers should be used to ensure proper claim processing.